about your and, in terms of what that means is that when it comes to going to college, for most people in this room, this is what they think about: going to classes, having roommates, friends, parties, that kind of thing. But there is a really good chance, it's almost a guarantee, that at some point being in college, college students get sick. And so questions of what happens, when something comes up from a physical health standpoint that students need support for. So I'm going to be talking a little bit about what the options are and how we manage them here at AU. So like I mentioned before, I run the Student Health Center, and we are an accredited health center, which is a distinction that most university health centers do not have, and are accredited by the AAHC, which is our ambulatory accrediting body. We basically function the way any primary care office would, and our opening hours are Monday through Friday from about 8 a.m. to 5 p.m. We do have some telehealth hours that are baked in during the day that we see students, as well as some after hours telehealth services on some of the weeknights. I know that a lot of times students might get sick when you are at night or on the weekends. Being that we are in Washington D.C., we do partner with a lot of our local resources. There's 2 urgent cares within a 7-minute Uber ride from the university. Students who get significantly sick or injured, there's an emergency room about 3/4 of a mile down the street from the university at Sibley Memorial Hospital. And then there's other, like I mentioned, some telehealth services that students have available to them. And everything I'm going to mention today is going to be, if you just Google American University Student Health Center, all this information is there, plus a ton of other information. So I really encourage people to look at that website. Mentioned before, we do everything that a typical pediatrician or family practice office does, in terms of providing primary care services. In addition to that, we do have a number of services that are very specific for our college age students. So specifically STI testing, we provide comprehensive care in terms of birth control. We provide HIV PrEP, transgender care. We do have a psychiatrist and a psychiatric nurse practitioner who can do consultations for patients for depression, anxiety, or other psychiatric concerns. So this is once again focusing our resources on things that a lot of times students are going to be needing most when they are in college. So anybody can be seen at the Student Health Center. This has nothing to do with like the insurance that the university offers students through Aetna. If you're a student and you're taking one class, you can be seen at the Student Health Center. Okay, it has so most of our most of our patients are who come in are on their parents' insurance. So as long as the insurance is accepted in DC, which is a requirement for for all students at AU, you'll be able to be seen here. And I really mentioned this. I know that there's been a number of parents and students who wondered, do I need to get a primary care doctor when I move to Washington D.C.? You really don't. We provide primary care services for all of our students, and so we are the primary care provider for the university. It is much easier to come in and see one of us in the Student Health Center than it is to go off campus and try and find someone. So if you wanted to go that route, that's totally fine. But our goal here is to try and make things as streamlined and easy and get students great care. Okay. For students making an appointment, go to our website or go to their student health portal. Many students have already been acquainted with this because you've submitted immunization records and gone online to submit your tuberculosis forms. So online scheduling is how about 90% of our appointments are made. We also do hold aside a number of appointments for what we call same-day scheduling. So students who are specifically ones who are sick, who need to be seen that day, a student who wakes up with a sore throat and a fever and wants to be tested for strep and treated for mono and that kind of thing. For those appointments, you'd have to call the Student Health Center and make an appointment with the front desk. Those same day appointments are not available through online scheduling. So I always tell students, if you go online, and you're at night and you're saying, oh, there's nothing available tomorrow, just call the next morning. We should have a bunch of appointments available starting first thing in the morning. Okay. I'm going to make 2 just quick discussions about psychiatric medications and ADHD medications, because we do typically get a lot of questions about these. Many students have been seen by psychiatrists in the past and like to continue the psychiatric care while they're here at school. We do recommend that if possible, students have an ongoing relationship with the psychiatrist where they're being seen only every couple of months by the psychiatrist, and they're relatively stable, we do recommend that they try and continue that care. Just it streamlines things as much as possible for students. Students who do want to be seen by our psychiatrist or psych nurse practitioner, the main thing is that we need documentation. So if if someone's coming in, they've been stable on their anti-anxiety medication for many years, we just make sure that the provider who's been seeing you at home is, has given us a letter or something, just some documentation that can say, yes, this patient's been treated for this stuff. So we'd have some background of what we're going to be treating you for writing prescriptions, that type of thing. ADHD medication is something that's a little tricky because the ADHD medications are by and large controlled substances. So it is really important that you talk to your pediatrician or your family doctor or psychiatrist if you're on an ADHD medication about how you're going to continue these medications when you're in college. One of the tricky things is that in Washington, D.C., the pharmacists cannot take an out-of-state written prescription for a controlled substance. So what that means is that either a student has to get all their medication at home and have it shipped to them in DC, or if their provider can do electronic prescribing, the pharmacies will accept that, but they cannot. The pharmacies in DC will not accept by law a written prescription, okay, on a prescription pad. For many of our patients and students, the easiest thing for them to do is to actually transfer their refill care of their ADHD medication to the student health center. If you're going to want to do that, that's great. You just got to go online and make an appointment for ADHD, first visit, or ADHD refill. However, it is really important that you understand a couple of things. We need to have documentation of the medications that you're taking. There's information on the Student Health Center website. Again, under forms, there's a form that the provider can fill out so we can have that information and be able to continue the prescribing. And also just to be aware that if one of the college health standards across the country is that for refilling ADHD medications, those refills have to be done monthly. Okay, we can't write it, we can't forward prescribe for like 3 months. And the ADHD medications, they're controlled substances, so by law we cannot write refills for them. So that students would have to come in once a month or whenever the prescription runs out in order to get their new prescription. Okay, and I know this is confusing, so I'm happy to answer questions about this at the end. One thing that you do need to do, and there's actually, it just says immunizations here, but there's actually 2 different things that need to happen. First of all, get us your immunization records. If you can't get them in before the due date of July 15th, don't panic. We will accept them anytime. As soon as you have them, get them to us. Make sure that your vaccine forms have been filled out, they're signed, and they're stamped by your doctor at home. Okay. Or there's another form that needs to be done, your tuberculosis screening form. That's a form that's required of all new students at AU. It is not an immunization. It's just a form that has to be filled out. So you go into your student health portal, fill out that form. Once the form is filled out, provided that everything looks good, there's nothing else you need to do. You'll be cleared. If there's any follow-up that needs to happen, you'll be contacted by the Student Health Center about what needs to happen next. And this angry person here is a student who had a registration hold put on. DC law requires that we put registration holds on for students who are not up to date with their immunization. So please make sure that this is a priority so this doesn't happen to you. I'm just going to list here this is my email address, and the website, the Student Health Center website, is american.edu/health center. There's a ton of information on there, and almost anything that you'd want to know is going to be on that website. So I'm going to stop here and just see if people have questions either in the chat box or people want to raise their hands, whatever is going to work for you all. And OLs, are there any questions in the chat box that people want to have answered? Okay. Tanish Kahana, I apologize if I didn't pronounce this right. You got the first question?
It's okay, it's Tanishka. How affected has no worries. How affected has AU been by the ADHD medication shortages that have been affected across the country?
So yeah, we've been very much affected with them, but by this, our students are in the same boat as students from all over with regard to those medications. So, we don't have any secret stashes. We don't, the prescriptions are filled at CVS and Walgreens. So what we typically do is we can, keep our ears out for who's got what in stock and can sometimes direct students there. But sometimes students actually do have to call around a little bit and figure out where they're going to go for some of these medications. It's a huge issue, and it's not an AU issue. It is a nationwide issue right now. I have another practice taking care of adolescents in DC, and I'm dealing with that practice also. So we're all dealing with this, unfortunately.
I have a question.
Actually, I think Susan was next. Okay. Susan, I think you're muted.
Thanks, I wrote it in the chat actually. So my daughter says that she has put in her immunization records, but she doesn't know if they've been sort of accepted yet or approved yet. So where does she go to figure that out?
Typically, what she would do is to go into the student health portal where she had submitted those records, and she should have gotten an email or saying that she had a message that she would have a secure message in her messages saying that either everything looked good or there was something that was being held up. So that's where she should look. It does take about a week for these things to be processed because we're getting like a couple thousand of them, and we only have 3 people who are processing them. So give it a couple of days, but if you're not finding anything in within a week, I would definitely just, you can shoot me an email, or they can send one of us an email through the secure messaging system, with the health portal.
Thank you.
Okay, Savannah, unmute yourself, please.
Hi, I was wondering, so as far as when you do study abroad and if you are using ADHD medications and the controlled substances and all of that, how does that work for kids doing the study abroad?
This is actually not a huge issue at all. We work with students and give them the education that they need in order so they will know. Basically, they call their insurance company and they tell them that they're going to be studying abroad, that they need a 3-month or 4-month vacation override. The insurance company will put that through, and then usually, just within a day or so, they can get this approved. It's generally not been an issue at all for that. That said, with the shortage, they do have to give themselves some more time to do this because they may have to call around and wait for the medications to come in and be in stock. Okay.
Is there any kind of restriction depending on the country that you're going to at all?
So every country is going to have different rules about this. For most of the European countries, at least, if you have a prescription, a sealed bottle, and maybe you might, some of them will also require like a letter just saying that this person actually has a diagnosis of ADHD and this was prescribed. That's all I need.
Okay, all right. Thank you. Appreciate it.
Welcome. And next, Maria.
Yes, thank you. In terms of EpiPen renewal and inhalers, is that something that could be done at your office, or we would take care of it back here at our home state?
So remember, we do everything, at the Student Health Center that any primary care office does. So we do tons of EpiPen renewals, inhalers, stuff like that. We probably would, if students coming in saying that they've got asthma or something like that, we probably do need, we can't just write it without seeing them. We probably do need to see them so they're established as our patient, because we're going to take ownership of, and the responsibility of prescribing this for them. But we can totally do any of those kinds of things. If it's done in a primary care office, we can do it. Okay, so if your pediatrician's ever written it before, we can probably do that for you. Yep.
Thank you.
Other questions? I see a question here. Is there an infusion center on campus? There's not an infusion center on campus. The closest one is there's one at Georgetown University Hospital, and that is probably the closest one in terms of the infusion center that we have. There's actually one in Tenleytown, which is a relatively short walk from campus. Once again, it's part of MedStar Georgetown University Hospital, but most students can go there very easily. It's not a big deal. Okay, that would just have to be set up with whoever is prescribing the infusions at home. Okay. And just let me ask, if somebody did put their hand up, can you put your hand down just so I don't have to call on you again? I'm not sure if anybody who asked a question before is asking another question. Do we have more questions? Savannah, do you have another question? Yeah, okay.
Yeah, sorry. On my student health portal under forms, the tab that says my forms, there's a bunch of things listed, and under appointment date, it just says NA. So do I need to like do any of those forms? I mean, I submitted my immunization form
Mhm.
and all of that, but yeah, I didn't know if there are any other forms that like
So-
that are listed.
So the main one in that list, okay, so all those forms are all there just in case if you, so if you, you know, so what, if you want to, if you're gonna be seeing Student Health Center, you will have to sit, you know, there's a form there, consent for treatment. So you're gonna need to do that one. If you're gonna do a telehealth visit, there's a consent for telehealth treatment. But the one big one that you need to do right now is the TB questionnaire, screening questionnaire. That's the one that every student needs to do. That you know, that will hold things up, and we'll have to put holds on accounts if that's not completed. So please make sure you do that.
Okay,
Um,
all right. Thank you. Appreciate
You're
it.
welcome. Okay, Joni.
Hi, thank you so much. I have a question about the ADHD medication.
Sure.
Do you recommend, and I just want to make sure I'm not confused, that we just get the prescription locally and have our student take it with them to the university, or do you recommend an appointment once they get there to refill?
You know, that is a really personal decision, and that, you know, it's kind of whatever is going to work best for you and your student. Okay. If your provider is, you know, can do that for you and can give you a 90-day or whatever.
Okay,
that's
we
great.
have a little over a minute, maybe 2 minutes left.
Okay. So if your provider is able to do it, that's fine. It really is. It's, you know, some providers are saying if you're not going to I'm not going to see you face to face, I'm not going to do a prescription. So it really does just have to do with what you and your student want to do. Okay. If students are wanting to be coming in and having adjustments to their medications, that kind of thing, and the provider doesn't do telehealth to, you know, have a license in DC, then they may need to move it to the Student Health Center. Okay. And I think there's one more question. I'm sorry, I'm not going to demolish your name again. Tanish?
Tanishka, you were correct.
Tanishka, yeah,
It's no
okay.
worries though. So when I tried to opt out of the university insurance, it said I needed to log in, but my email wasn't associated with an account, but I couldn't find a link to like create an account. So how would I do that?
Okay, go to AU Central to create an email account or create an account with NFP.
I think NFP, so I can opt out of university healthcare.
Yep. So yeah, it's a really important thing. You've heard about this. You know, most students do not get the university. It's not really the university's plan. It's Aetna that you know, and it's a very good. It's an excellent plan if students, you know, want to get it. Go to the AU Central website. Okay, american.edu / I think it's / AU Central. And there should be a thing on there for about waiving out, and you basically will create an account with your AU ID and password, and you know, to get into there. And it's pretty straightforward. You just have to give a photocopy of or give a photograph of your insurance card, front and back sides. And yeah, it takes about a week or so, and then they'll let you know what the outcome of that was. Okay. Any other last questions before I think they're going to zap us back into the main room? Okay. I think, well, I'm getting a message that they're taking us out. So once again, welcome everybody to American University. If you have questions, just shoot me an email. I'm happy to talk to you, email you back. Let me know if you need anything, and hopefully I won't need to see any of you too much, but I'm looking forward to meeting a lot of you. So thank you so much, and have a great rest of your summer. See you next month.